types of injury and management. Next, review of the anatomy and review of the anatomy, physiology of the nervous system, spinal column. Identify the types of injuries and different types of injuries of head and spine and describe their features. So we'll identify different types of mechanism of the head, spine injuries, and their features. Next. Describe the assessment of head and spine injuries. We'll describe the main objective is to describe the assessment of head and spine injury. Next. Responsible for 1/2 of the death that occurs secondary to trauma. So it is responsible for 1/2 of the deaths that occur secondary to trauma. The major cause of long-term disability caused most frequently by falls and MVAs. It is because of falls or MVA, right? Next. And it can be prevented by putting helmets. So MVA means road traffic accident, and it can be prevented by what?
Wearing helmets.
Right. Did you make me the co-host?
Yes,
Walid?
Sastry ji. Yes.
So this is the nerve cell you can see. This is the motor nerve. This is the posterior anterior nerve. Can you see the cursor? This is the connecting nerve and this is the spinal cord. So if this is injured, the motor and sensory nerve are injured. You understood? This is the nerve cell anatomy. Can you see the cursor?
I mean,
And this is protected by a fatty coating called myelin. Nerve impulses are transmitted across the synapses. So through this process, nerve cells are what? Transmitted through synapses. This is a motor nerve, this is a sensory nerve, this is a connecting nerve cell. So whenever there is a spinal cord injury, this connective nerve cells breaks down. This is the spinal cord. This is the central nervous system, coronal section. This is the spinal cord connecting to the brain stem. Yes. Cervical, dorsal, lumbar, and this one. This is the peripheral nervous system. These are the spinal nerves and their branches. You can see the branches of the spinal nerve, and this is the foramen magnum, cerebellum. This is the caudalicuna. is the lumbar plexus. Right? You can see my cursor.
No, sir.
No, sir.
No.
I'm moving my cursor. You cannot see.
No, sir. Cursor is not seen.
Oh, since I'm not operating the
No,
system.
I'm able to see the cursor. I was able to see.
No, I'm moving
near
the
the-
cursor. Can you see it?
Now it's not visible, sir. Earlier it was. Now it is not visible.
Sir, earlier it was visible, now it is not appearing.
Now?
Not even now.
No, sir.
I don't know.
Sir, there is an option for laser pointing in that presentation. Maybe if you can use, that will be better.
No, it is actually broadcasted from
सर अब दिख रहा है कर्सर
दिख रहा है?
जी
Now the cursor is visible, sir.
Now, where it is?
This is my cursor you are seeing. Sastry ji, your cursor will only come if you are the one sharing the presentation.
So, are you in a free time to show them what I am saying?
Let me follow. You can see my cursor now.
Yes.
Lumbosacral plexus,
Yeah, this is the lumbar plexus, spinal nerves,
spinal nerves,
spinal cord. Then comes the brachial plexus. Above is the foramen ligament and the cerebellum. This is called the peripheral nervous system. It's the spinal nerves and their branches. Here there is a spinal cord injury, so the patient suffers. If there is a spinal cord injury, there is no recovery for spinal cord injury as per medical science because the connection between the brain and the nerve is there. But gradually with the principles and gradually if you work, you can recover the spinal cord injury. Am I right?
yes, Sastry ji.
Next. The meninges protective a triple layer. What are durameter, outer layer, and matter, middle layer, diameter, inner layer. So cerebrospinal fluid circulates within the aerocoid matter. This is the anatomy of the skin, fascia, muscle, skull. So this is the importance of the fascia because it is very closely associated with the skull. Aerocoid, cerebrospinal fluid, blood vessels, diameter, and the brain. So you can see how so this is the anatomy of the brain, cerebellum, and the brain stem. So brain has three parts. What are they? Cerebellum, and the brain stem. Of the brain provide sensory motor supply to the head and face. You can see cranial nerves originate at the base of the brain and it provides sensory and motor supply to the head and face. Right? You can see the cranial nerves, names of the cranial nerves. They are around 12 cranial nerves, right? Next. These are dura mater, body of the vertebra, intervertebral disc, sympathetic ganglion, transverse process of the vertebra, spinal nerves, spinous process of the vertebra, anterior root and posterior root, and spinal cord. This is spinal anatomy. Now, if you see the motor nerves, brain to muscle units, now these are important, and sensory nerves, skin back to brain. So motor nerves goes from brain to muscle, and that is why we say NIBS is important. Non-invasive brain stimulation is important because it helps you to recover from brain to muscle. And sensory nerve, what we use peripheral to the brain, right? So there it is secondary where
Brain.
so one good news is for you. We'll give you 1 month free training in brain stimulation. Anyone can join.
So 1 month free training, anyone can join with country
If
name
they
or with
don't
just
join
any
with
name.
country name and attendance is not there,
Okay,
certificate
thank
cannot
you.
be given. From tomorrow, you can write free acupuncture training. For the sharing and compressive. Traumatic is compressive. Next. So types of brain, abilities to damage to the brain. Physical damage to the what? Here you can see the brucisation involves physical injury to the brain. It is a permanent injury. It may belong inside the brain. Means internal bleeding inside. So you can see you can see. Traumatic brain injury general signs and symptoms: headache, dizziness, nausea, and amnesia means loss of memory. The decreasing level of responsiveness, confusion, combativeness, loss of responsiveness, and symptoms. You will see decreasing level of responsiveness. The people become less of responsiveness. And the loss of brain function and progressive deterioration, right? There is verbal or unresponsive. Often decline, it is between 5 minutes. Walid, I think this is gone. It's gone.
He's back, Sastry. Light
Change
network
in
feedback.
pupil size and reactivity of light, going of the pulse, and rising of the BP. These are the 3 signs of what? will have what? Reactivity to the light, slowing of pulse, and rising of BP. Change in respiration, unilateral weakness, incontinence, and seizures are the main signs of hand injury described previously. Resume cease oxygenation has been mobile for so in number this area or coaxial area, right? Next. This is a typical vertebra of the spine. Here you can see the nerve compression. Bone and spine injury, you can understand it is called cervical spine injury. Local and acute tenderness may be there, and the bending of that compression or bending or trauma. These are produced by three things: compression fracture, bending, or trauma section. Self-splinting or guarding, deformity usually not obvious. Deformity is not obvious, usually obvious. So any and others, I request you from tomorrow, you can from 14 onward, today's 8, 9, 10, 11, 12. From 12 onwards, we'll start what? 1 month free acupuncture course. You can write down in the what? Interactive session from 8. And it is a certification course. Certified 1 month training in acupuncture and pain and other orthopedic management. Trauma and orthopedic management, right? Neuro, trauma, and orthopedic management. It is a free course. No need to pay money. So this is a compression fracture. You can see. Walid, can you see the third vertebra? There is a block. Please show your cursor. Yeah, this is called the compression fracture. You can see the broken of the bone. So the broken bone, go down, little down. Yeah, here you can see. Please don't write your name of the country. It will be very difficult for us to take your. Write the name of your country and your name. Not here, there in the while entering in the Zoom class. Otherwise, your attendance will not be counted. Like Habib, who is Habib? We do not know which country is. How we will certify who is Habib?
Okay, sir. I'm new. I'll write it down correctly.
You write, you enter as UK or your country name, and then Habib.
Okay, sir. Okay, sir.
Yes. Next. Generally, trauma happens on cervical 5 and cervical 6. It leads to quadriplegia, right? It leads to what? Lack of movement in both upper and lower limbs. And it can be very well recovered. It depends on spinal cord injury, whether spinal cord is injured or not injured. So spinal cord is more injured with neck and thoracic, less with lumbar. Right? Where is the main injury? More in the neck, then in the thoracic, then in the lower area. Clear?
Yes,
This
sir.
cervical 5, here you can see the cervical cord injury, you can see cervical hyperextension, flexion, rotation. Higher the cord injury, the more the nerve fibers are damaged. Can you show the injury? What is your name? Walid, can you show them the injury? In cervical 5, down, down, down. You can see the
Yes.
displacement of the vertebra. Go down, more down. Yes, this is the cervical cord injury.
Okay. Okay, the bone is down there.
Yeah, bone is down there, right.
Okay. Okay.
In thoracic, you can see this. T4 and T5. Here you can see. Can you show them the bone injuries? Yes, you can see.
Yes, sir. There is opening there.
The opening, right.
Yes. Yeah.
Next. Paraplegia, quadriplegia, hemiplegia. They are the three things which you will see in spinal cord injury. Right? Next. Abnormal sensation, loss of sensation, and muscle weakness and or paralysis. Muscle weakness or paralysis. Three things are seen, right? And it can be connected by only two ways. Either by non-invasive brain stimulation, which has been very clearly said, or self-correction, or by needle which we use. Signs of neurogenic shock, difficulty in breathing, incontinence, and priapism. Next. Emergency care is always airway, abnormal breathing. Urgent intervention is required, stabilization of neck is required, and care for other injuries should be there. So CID collar is main important and long spine board is important so that the patient has minimum what? Movements. Patient has minimum movements. Thank you. Close the slides. Ask your questions. Fourteen onwards, there will be free training. Please write down in the this one from 14 1 month free training in acupuncture and writing stimulation for different diseases, especially in ortho and neuro and developmental cases.
Thank you, sir.
So one doubt. Sir, when we talked about concussion trauma, whether it happens due to emotional trauma or a physical.
It may be a physical trauma. What is conclusion? What do you mean by conclusion?
No, physical damage has not happened, but the ability of brain get disturbed.
So it may be two things. It may be physical, it may be, generally it is physical. Am I right or wrong?
Okay.
It is a external injury. Contusion is always an external injury, right?
It is written that without apparent physical damage of brain.
I do not know. Contusion is always means that, see,
Okay.
any injury inside the brain. Generally, if you see contusion injury, maybe because of hypertension and all, or any other issues, and external issues also are there. So it may be internal issue or external issue.
Okay, sir, both can happen. Okay.
Both can.
Good evening, sir. Mukesh Rawat.
Admit कर दिया. Admit कर दो. हाँ मुकेश जी.
हाँ, sir. In cervical cord injury and lumbar spine disc pain, the belt should be how long used?
It depends until the surgery is done and the spine is stable. And then the condition depends from case to case. Injury and case to case.
Okay. After recovering of all the symptoms, we can
You can recover the patient. Yes, paraplegia, quadriplegia can be recovered
Okay, sir. Thank
to a
you.
great extent.
Yes.
The way we teach them wheelchair mobilization, I don't think so it's correct. You can recover a patient to a great extent.
Sir, while a brain injury happens, it is said that we should not the patient should need to be laid face down. Is there anything like that, face down or face up?
It depends on what kind of injury it is.
Oh. Okay, I have heard that if any internal bleeding happens, if you are keeping your face down, there is chance that the blood will drain through the nose. Otherwise, it will clot
It
inside the
will go
brain.
inside, right? But then it depends on the type of injury you are having. There are many types of injury. You have to specify which kind of injury you are saying of.
Okay, okay. So any of the case, the important part is that we should not tilt the head, right? Neck.
Yeah.
While taking and hospital and all.
Yeah.
Okay, yes, thank you.
So these are the primary things which we should know while we learn how to treat things with acupuncture. What are the different stages we will gain? How is paraplegia, quadriplegia, and all these things are recovered? This we will know gradually. So please mention from I think which date? Today is 8, na? 9, 10, 11, 12. From 13 onwards, we'll start free certification course. 1 month free certification course on acupuncture and pain management in ortho and neuro cases. Right?
Nico.
Sastry ji,
Hmm.
please, tomorrow we are starting the free training program for 1 month, right?
Not tomorrow, 14.
Next
Not
week?
13, next week.
Okay. And from then on, only people with country name would be admitted, and only
No
those.
need to disadmit anyone. Their attendance will not be given and their certificate will not be given. That's all.
Okay, no problem. It's
Because
just to avoid this.
the attendance
It's just to avoid the stress of, sir, I was in class every day, but I don't see my name. Then you ask him, what is your name? He tells you his name is Walid. Then you ask him, I don't see Walid. He says, okay, I'm iPhone.
So we do not know all this.
Okay.
Simply answer, they do not know all this. Did you
No
read
problem.
the message? Yes. So, as per the rule of the institute, did you go with the rules? No. Disqualify. We can't help.
No problem, Sastry. Thank you very much for making it clear.
Right?
Right, Sastry ji.
More questions? More questions? More questions? These are the basic things you must know. Then you must know how to recover the patient. And then
Good
you
evening,
will know
sir.
what meditation. Siddheshwan, tell me.
Hi. You are remembering very. Thank you, sir. Thank you. Just I want to do your course, 3 months course. So
1 month you do. This one you do the other also.
okay, sir. Okay, sir. What are one question, sir?
Hmm.
Can you hear me, sir?
Huh?
Can you
Join
hear
the
me,
group.
sir?
Join the group with all details.
Yes, sir. Yes, sir. Thank you, sir. Thank you, sir. One question, sir. May I ask?
Yes.
Yes, regarding SCI, spinal cord injuries, what are the priorities is to be given? First line of treatment. First line means after
First line
relieved
of
from the hospital.
surgery. No, first line is line of surgery. Spinal cord injury needs spine fixation. The first is spine fixation has to be done. Then trauma is stitches are removed. That is stitches are removed. Then surgery is done.
Okay.
Next.
Thank you, sir.
Any more questions? Any more questions? Okay then. Thank you all of you.
Good night, Sastry ji.
Thank you, sir.
Thank you,
Good.
sir.
Thank you,
Good
sir. Thank you,
night.
sir.
Thank you, sir. Good
Uh,
night.
Good night, sir. Thank you.
Yeah, Wally, thank you.
sir. Good night, sir.
Good night, everybody. Shutting down.
Thank you very much.